I'd like to invite Dr. Elise Lopez to the podium. Dr. Lopez is an Assistant Director of the Relationship Violence Program and the Health Promotion Sciences Department at the University of Arizona, Mel and Enid Zuckerman College of Public Health. Dr. Lopez will speak about safer bars, bystander training for staff of alcohol-serving establishments. Welcome, Dr. Lopez. Oh, there she is. Let's see, does this just go? What do I do? Yeah, I think these are, let's see, keep going. There we go. All right. Thank you all for hanging in. I know it's just about the end of the day, but what I'm super happy about actually with going last, I feel like last is kind of a weird place to be because you never know, are people actually still going to be here? But what's really great about being last today is that you've had a phenomenal who's who group of speakers talking about all kinds of research that became the evidence base actually for this program. So this is called Safer Bars. The tagline is "Help is on the house." And it is a bystander training program for people who work at alcohol serving establishments so that they can learn to safely and effectively intervene when they see sexual aggression being perpetrated by bar patrons. But before I talk about the actual program, I'm just going to give you a little bit of background on how it's structured because it's kind of a different type of implementation and study that we've done compared to what you traditionally see in research. And I'm going to talk a little bit about why we would do this in the first place. Why don't we just kind of pick up general bystander training and stick it in a bar? Why do we need to modify this? How does that work with college campus settings? So I'm going to talk about all of that and then talk about the program itself. So Safer Bars started off as an initiative of the Arizona Department of Health Services, and the development and initial implementation and the current implementation has been funded by the CDC's Rape Prevention and Education funding. And this actually came about all the way back in 2007. Our state health department was doing focus groups around the state to come up with a state plan for sexual violence prevention. And during one of those focus groups, there happened to be a guy in there who owned a bar who said, "We see a lot of sexual aggression in our bar. Why don't you train us to do something about it?" And that started this whole cascade of other work to look into what would that actually look like in a bar setting. And this idea had started to come up in different places around the country, but the Arizona Department of Health Services really took the lead on developing a solid program to do that. So initially, they had a bunch of focus groups around our state. They did a Delphi survey to look at what should be in the training components. They talked to people who worked in bars, who owned bars, people who go to bars, to figure out what that should look like. And ultimately, what it became was what we called the Arizona Safer Bars Alliance, or ASBA for short. And the partners in that are many. So our RPE subgrantees are agencies around the state that do prevention programming funded by RPE. They all have a requirement in their contracts to do something regarding safer bars, whether it's recruiting bars or actually going out and doing training. We obviously partner with alcohol serving establishments. We also partner with law enforcement and our Arizona Department of Liquor Licenses and Control. So it really is a statewide initiative involving folks at many different levels. To be in the Arizona Safer Bars Alliance, there are membership criteria that the bars have to meet, and there is an annual renewal process. So once a bar completes all of that membership criteria, the next year they have to meet similar criteria in order to be re-upped. The central part of their criteria is completing the Safer Bars training, which is a multi-session training program for their staff. They have to train 70% of their staff who have direct face-to-face contact with patrons as part of their regular job duties in order to meet the training requirement. And the way that the University of Arizona is involved is we partner with the state to make sure that the program is always based in the best science in terms of content. We work to evaluate the program with them. We provide technical assistance to everybody who's working on this program inside our state, and I'll later talk about this outside of our state. I forgot to mention, so as part of doing that technical assistance, we actually have a team based at the University of Arizona that does that. So this is an initiative of our state health department, but all of the evaluation, technical assistance, and separately research on this program is done by our team in-house at U of A, led by myself and Mary Koss. So why would we centralize this, for example, around college and university campuses? That's why that relates to why we're all here today. So as we have talked about today, there are a lot of risk factors involved with college students. We know that college students are at a particularly high risk for victimization. We know they're at a particularly high risk for perpetration behaviors. Bars are an extremely sexualized context, right? Many people go to bars with a partner or looking to hook up for the night. You see drinks named things like sex on the beach. There are also hotspots for police reports of violence. So if you look at GIS mapping that compares police reports for physical and sexual violence to places where you have a high density of alcohol serving establishments, you see that there's an overlap. Where you have lots of bars all in one place, you tend to have lots of police reports for violence. And these aren't necessarily inside of the bars. They may be around bars, on the sidewalks, in parking lots, but they're in that same physical area. So even if bar owners or staff don't necessarily see violence happening inside of the bar, it does often extend to right outside of the establishment area. And over the years, we've also seen, for many of us as researchers, but also from funders such as CDC, really this conceptual move from going beyond individual level interventions and really starting to look at how do we affect relationships, right? Hence a lot of our bystander work, but also looking at environments and policies. How do we identify environments that facilitate sexual aggression and make changes in them to stop that? And we also know, of course, alcohol increases perpetration risk. And there's a huge body of literature that looks at all of these different areas. Additionally, there's a huge body of literature that specifically looks at sexual aggression in bars. How does that show up in a bar environment? What kinds of steps do bar staff take or not take when they see sexual aggression happening? So we have all of these different bodies of literature that we've put together to inform this training program. And in Arizona, we actually do centralize that around the 3 main college campuses in our 3 major cities. So the next question we have to ask ourselves is, why would we need bar-specific bystander programming? Why can't we just take our typical bystander concepts and just transplant them into a bar? So what we've learned from working with bar staff is they have a whole other set of considerations that we need to think about for this programming. First of all, with bar staff, there's this huge cognitive tension between caring about things that are a crime versus things that are not a crime. So there are lots of ways that sexual aggression can show up in a bar that don't meet the level of a crime, right? But for bar staff, they've typically been trained to call police as their point of intervention for dealing with physical or sexual violence in their context. So what they're looking for most of the time is a crime that's being committed so that they can call the police to deal with it. What we're trying to do is move away from that into an idea of if you can recognize sexual aggression and intervene early on, you don't get to a point where a crime is being committed and you have to call law enforcement to deal with it. So we have to address that in bar bystander training. They also have unique liability concerns. So when we're dealing with bar staff, one of the ways we get bars really interested in doing this kind of programming is looking to state statutes. And these vary across states, but typically in our states, bars do have some level of statutory liability for patron safety. Sometimes that's very broad, sometimes it's very narrow, depending on state statutes. But one of the things that's always in the back of their head is, how does this relate to my legal liability? That can sometimes encourage people to do things like take rape prevention training. However, it can also sometimes scare people away, because there's the thought of, what if I intervene and it escalates and something bad happens, and then my bar's liquor license gets revoked? So there's a lot there to unpack. Their motivation for helping is very different. This is not a setting where we can walk in and ask people to do sexual assault prevention because it's the right thing to do. Bars typically do not sign up for this out of the goodness of their hearts. Some do. You get those occasional bars where the owner's like, oh yeah, we definitely need to do this. It's so important. I'm going to get all my staff in there. We're going to get 100% of people trained. It's going to be great. But for the most part, they're interested more in things around their liability. They're interested in their staff being safe and their patrons being safe, of course. But the motivation for staff is less on, let me do this out of the goodness of my heart because it's the right thing to do, and more about helping because they need to keep their environments safe legally. And patrons aren't their friends, so that also, in some instances, decreases their motivation for helping as well. We also have unique opportunities and barriers for intervention. One of the ones that we hear about a lot is social capital versus actual capital. So often when we're doing bystander, let's say with college students, a lot of times our college students are worried about intervening because of social capital. They don't want to be seen as a tattletale or somebody who's ruining the fun or a good time. They're worried about if something escalates and the spotlight is on them, how is that going to feel? There's a lot of normal fears that they have. And those extend to bar staff, but there are other barriers that come up too. For example, actual capital. In many of our states, liquor servers can work for less than minimum wage and they rely on tips. So for somebody whose rent and bills depends on getting good tips, potentially having somebody walk out on a bill or leave them a bad tip because they made a comment against that person's sexist comment they made at the bar may not be worth it to them. So how do we deal with that? So there are a lot of unique considerations, and that's just one kind of slice of the pie for different barriers that we see with bar staff. So what do we add then if we try to transfer that into a training program? So in black, we have a lot of the sort of general categories that we use in bystander training. And so in red, you see things that we use to change it up when we do the Safer Bars training. So in terms of sexual violence definitions and statistics, we obviously talk about those, but we expand to talk about sexual aggression beyond things that are crimes. So we definitely talk about rape, we talk about other types of sexual assault, but what are those other behaviors that are sexually aggressive that, especially in a bar context, people may brush off as flirting, for example? What is the bystander effect, but how do social norms influence the bystander effect in bars? For example, how does the way somebody is dressed in a bar, consciously or unconsciously, change the way a bar staff member might intervene or choose not to intervene? Reasons for not intervening, there are lots of environmental and peer support barriers. So we have those internal individual fears, but there's a lot going on in an environment that facilitates sexual aggression. You also have the fact that somebody's in their workspace, they have obligations to their job duties. So for a bartender who has to be stationed behind a bar and they see something going on far away, can they leave on a crowded Friday night to go intervene in that situation? Probably not. So what's the protocol going to be to deal with that? There are also peer support barriers. One of the things that we've learned doing this program is, you know what, we can teach bar staff to intervene until the cows come home. They may have a lot of self-confidence and really think that this is a great idea, but if they feel like their staff peers are going to laugh at them for intervening or their management is going to write them up for leaving their station, they're not going to do it. So we need to deal with those items. We talk about how to notice a situation, but bars are loud, they're dark, they're crowded, so we talk about unique barriers to noticing. We teach them to look at strings of body language and cues, because often you may not be able to hear patrons' voices. We also really look specifically at the difference between flirting and aggression. Tinder dates come up a lot. That's a kind of just an aside weird thing that comes up a lot in bar bystander training, is they can notice when somebody's on a Tinder date that's going wrong. So that's been interesting. You know, people's faces give it away when they get to the bar and realize that their date doesn't look like their profile picture. So anyway, for the Q&A. So how to help and intervene? We focus a lot on skill building that involves a range of skills and when each skill is appropriate to use. We also practice with knowing why we use different skills in different situations. And this was added more recently. If you look at the literature on training transfer, how we actually get information from ourselves as trainers to people who are our trainees, what are the best practices for doing that? And one of the most valuable things we can do is having people verbalize the why behind something. So it's not enough for them to know, oh, in this situation, I should use this technique. Well, why would you? And it seems like a duh thing to do, but when people can verbalize what's the sexual aggression that's actually going on here and how is this technique the best one to use to intervene there, they're getting extra mental practice with it. And it builds those neurological connections so that they can go back to that when they see it later. So we focus a lot on the why as well. And at the bottom, all the other things to consider. So liquor laws and liability become very important in this kind of bystander training, environmental risk assessment, bar policy and procedures, and understanding alcoholic myopia. So we're really kind of moving beyond that, just that stranger danger and who's the creeper in the bar, to really being able to talk about, you know, if we know there are all these different trajectories of perpetration behavior, it's not always going to be the creepy guy in the bar. It often will be, but there are a whole other range of people who may be affected by things like alcohol or have really bad communication, and not to say that this is a miscommunication thing, but when people are drinking and their ability to read social cues are moving a lot slower, we know from research that it's not women at the bar aren't saying no, right? We have all of these other barriers up, so we have to talk about that. So what does our program look like? This program is a CDC-funded program, so we strive to meet the criteria that CDC recommends for sexual violence prevention. So this program is multi-session, it's non-didactic, it's extremely interactive, it's based in adult learning theory. It's a total of 5 hours divided into 2 sessions that are held about 1 to 3 weeks apart. We tend to hold them in the bar space if they have an area where we can do that. People like being on their own turf. We focus on perpetration prevention. So we're really focusing on how do you recognize sexual aggression, how do you respond to that. We work across multiple levels of the social ecological model, right? We love our concentric circles, we love our pyramids, as Anne said. So we're looking at the individual level, right? We're doing individual level education, but we're also working on their relationships with each other. We're also working on their environment and policy attributes. So part of our second session is having them work together to do a scan and also to do planning for changes in their physical environment and their policies. So we're looking at not just things like lighting and noise level, but where are there dark corridors? Where are there places where you don't have staff for various reasons? What kind of policies do you have that might hypersexualize women? For example, do you have free cover for women on Thursday, Friday, and Saturday nights, and 25-cent shots for women on those nights, right? So all of those kind of things that they might be doing to encourage women to come to the bar, but that may ultimately be hypersexualizing women and facilitating sexual aggression. So we go there. We also evaluate beyond knowledge and attitudes. So this is sort of a new place for us. This was originally evaluated just at that sort of basic level as a pilot, and at this point, we are collecting data to look more longitudinally at behavior and environmental change 3 months later. So, what did this look like in our pilot study? When this was first developed, it was piloted back in 2012 by the Department of Health Services in Flagstaff, Arizona, which is in northern Arizona near the Grand Canyon. It's our 3rd largest city and has our 3rd largest state university there. And like around many universities, it has its little alcohol area where you have all the bars. So we call that a high density of ACEs, alcohol serving establishments. And they did quite a few little pilot studies there. There were 2 where they collected evaluation data. And one of the most interesting things that came out of that actually was through the demographics. Is there was this assumption that bars had this really high turnover. How are we even going to train these people when there's such a revolving door? And they didn't find that at all, and we continue not to find that. Most of the people who work in bars, even around college campuses, this is their turf. This is their industry, which means A, it's easier because we only have to do an annual refresher and we can kind of expect the effects to last. But B, it also means that we can't come in there as trainers and tell people how to do their job, right? People are going to turn off immediately because they're the experts in this, right? So what happened with that pilot? I'm just going to kind of quickly summarize. I'm not going to show you data tables from that, but the results they found that were statistically significant was there was increased self-confidence with things like seeing somebody who's hitting on a person who didn't want it, saw someone isolating a person from their friends. So they felt self-confident that they could notice these types of sexually aggressive behaviors. And they also felt less dependent on other people to do something about it when they saw things like sexist comments, isolation, buying excessive drinks for somebody else but not drinking much yourself. And they had a lot of knowledge of active bystander information. And so, you know, that sort of baseline stuff was pretty good, but there were some limitations to it. So first of all, there was no identification at that time of a mechanism of change. So why is this program supposed to change people's behavior? What's going on behind that? There were also, of course, very small sample sizes in this pilot, so it's a huge potential of chance findings in some of them. We also saw that there was a ceiling effect with the knowledge items, so the sort of true-false knowledge area of the evaluation surveys was too easy. People were getting them all right the first time, and of course they would get them all right the second time, so you see no change there. There was also really limited data at that time on perceptions of peer support, and we were missing information about environmental influences and other risk factors at that level. They also at that time, of course, were not measuring behavior because this was just a very, very early pilot. And so there was a lot of room for expansion, which was challenging because, you know, the idea came in 2007, the pilot was in 2012, and so then it was a little bit of a letdown. The program sat on a shelf for a minute. Definitely, this was the reaction. Whoops, that was backwards. So what happened after that? So we kind of spent some time refining the program and doing a little bit more longitudinal evaluation with it. So 2014 is when the U of A was contracted to come in and kind of overhaul the program design and the evaluation. So what did we do for the first 2 years? Well, first of all, we built a program logic model so we knew what we were doing. We did some curriculum mapping and revision, so really looking at, okay, what's in this curriculum? How much time are we spending on each component of it compared to what our desired outcomes are from it? We came up with a theoretical model for it based in the theory of planned behavior, which I'll talk about in a moment. We revised all of the evaluation instruments. We came up with fidelity monitoring tools. This was and still is a statewide initiative, so of course we need to make sure that the program is being implemented the same everywhere that it's being used. We came up with a 5-year plan for the program and also an outreach plan to get bars more engaged. And one of the things that was most important about this work was really being able to streamline a theoretical model for it, corresponding curriculum components, and then the evaluation instruments. And, you know, for those of us who are scientists in the room, it's kind of a no-brainer that all of those things should match up. But what happened here was kind of a little bit backwards from how we normally do it, right? There was a program that existed, it was great in concept, but it needed a little bit of foundational restructuring. So that's really what we had to do for the first 2 years to get it to a place where it really was evidence-informed and evaluable. So we started with the theory of planned behavior, and the theory of planned behavior is fantastic because in a nutshell, it basically says that when you intend to behave in a certain way, you're pretty likely to behave that way. So what we have to do is we have to work on people's behavioral intent to intervene when they see sexual aggression in their bar. So we know that people come in with their own stuff, right, that may predispose them to caring about this more. We know they may be in a higher low-risk environment for sexual aggression to be perpetrated. And we know we want them to act as active bystanders later. So what we do with our program is really work on their attitude toward behavior, their perceived norms, and their self-confidence to intervene. Those are the 3 main categories that make up behavioral intent. So everything that happens, every program component, is aimed at one of those 3 items. And we also evaluate those then later temporally over time. So what are we looking at generally at this point with our evaluation and later with our research project on this? We do have a process evaluation where we're looking at recruitment, fidelity monitoring, so what's going on in different cities with the implementation. We look at annual refresher rates. We just started doing annual refresher trainings with bars that had been trained last year. And in terms of outcomes, we're looking at those at all levels of the social ecological model. So we're looking at environmental change. Do they make any modifications after having this training, and how did that work out? What about their bar policies? Do they change those 25-cent ladies' nights? We're also looking at their different individual and relational outcomes, so knowledge and attitudes, behavioral intent, and actual behavior later. So looking ahead, sort of where are we going with that, because that was just a very quick overview. Right now we have safer bars in 4 major cities in Arizona and also 1 rural community. And with all of the data that we've collected for pre-post and then 3-month post training, we do have a separate research project that we are working on with that data to look at a moderated mediational model based on the theory of planned behavior, so we'll be looking at that. We're also working on supplemental modules for customization, so we have this core training, but how do you adapt it, for example, to gay bars or rural communities, but also without being tokenizing of folks. We also are working right now on a pilot scale up to New York, so we've trained people in all 6 regions of New York in safer bars, and we're looking at how that will play out. So that was our quick overview. This is one of our posters. These actually go in bathroom stalls. Bar staff told us, you know, we don't want just big posters in our bar environment. We actually heard this from patrons too. They said, if I'm trying to get away from a creeper, I'm probably going to go in the bathroom. But also, after I've had 5 beers at the bar, I'm probably going to be peeing for a long time too. So make small posters and put them in bathroom stalls. So this is one of those. All right, I'm happy to take any questions you have. Thank you. That was the quick and dirty version. So.
I would think it would be hard for bartenders to notice things because they're so busy.
Hear me?
Yeah, go ahead. You can say it again.
That I would think it would be hard for bartenders who are so busy running around to notice things going on in the bar unless someone came to them, like from this poster.
Yeah, so it is. It's extremely tough for bartenders to notice things. And so one of the things we're working on is really getting anybody trained who has face-to-face contact and improving communication between folks, whether it's through walkie-talkies. There's one bar we worked with that has sort of an internal phrase they use when they need help with something but can't get to it. But the noticing part, you know, we've actually recognized with a lot of bars that they are noticing more than they let on, even though it's busy. Part of that job is just intermittently scanning the room just to see who's there and what's happening. So with bartenders, they may not always be noticing really tiny things happening across the room. They're going to notice those bigger things. But with barbacks who are moving throughout or servers who are moving throughout, they're the ones that tend to notice the really nuanced things. So we kind of end up with this this interesting structure of people noticing different things. And so how do we increase communication between them so that somebody can intervene has been something that we've had to work on in the last few years. So we actually, in the second session, provide space for them to come up with house policies and protocols for dealing with exactly that problem. Yeah.
Hi, thank you so much. That was a really fabulous presentation, and I've been really interested in this work for a long time, so it's great to hear about where you are with it. I have sort of a spin-off question, which is we've been doing some work lately looking at strip clubs, and specifically we're looking at the relationship between strip clubs and sort of community-level crime rates, though. But we know from looking at this issue more lately that, of course, there's also a lot of sexual violence happening within the club, from patrons to performers, trying to think of the best word for that, or you know, also other staff in the strip club involving performers, or also crime that happens in the parking lot and whatnot. So I was just curious if something like this might actually be adapted to that kind of environment, or if you think something like that would work, or if it would be a major adaptation or a minor adaptation. Just a random thought.
Yeah, no, that's actually something that we've been trying to tackle as we get more, news coverage and things like that in Arizona. Is we get places that we didn't originally think were going to contact us to ask for this training, and so we have not yet done this training for a strip club. But it's something that has come up, and you also have these kind of unique situations that come up there. I think there are a lot of components of this that are particularly useful, but what we're seeing, and I think this is not just strip clubs, but even in just your average bars, is people are saying to us, what do we do about problematic staff as well? Eventually, yeah, you can fire somebody if they're being harassing, but you have a lot of environments where that's not necessarily happening, and people are having to rely on coworkers as bystanders to do something about it. And at this point, we are not addressing coworker harassment and aggression. So I think that's kind of a next step for this. Yeah. Was there another?
So I kind of just want to make an overall comment and thought. I'm a trauma therapist now, but the last 10 years I've been doing more just in the clinical setting. But prior to that, in a previous life, decades ago, I did public health work, and I used to do a lot of work with running programs for sex workers, both public health, both within the jail, and I think one of the things that really stands out is, this line, let us know. And certainly I know there's lots of questions, there's lots of technicalities, there's these pieces, how does this work? But I think about this, I think about Dr. Miller's work, I think about, the other speaker, and we really are helping to create this narrative for people within our society that somebody's here, someone's listening, you're not alone, we will help you when you're ready, that you have that strength and that ability to ask. And a lot of my questions are how do we show that the intervention, how do we show that this particular intervention works? Certainly that question's there for me as well. How do we sort of gauge that? But how do we also gauge the power that we help create, someone with them creating their own narrative about how we see our society? So I kind of wanted to point that out, and also I don't know if there's a way to sort of quantify that. If there is, I'd be interested.
There's so much to untangle there.
Yeah.
Yes.
Thank you.
Yes. So I'm going to start with how we measure that with the bar staff. So with the bar staff, when we're looking at their changes over time, we're of course looking at their knowledge and attitudes, but we're looking at their behavioral intent over time. How does that change? But with their behavior, we really get into the weeds with them because this just hasn't been evaluated this way before. So we're looking at what kind of events did they notice in the past time reference. What did they think to do when they saw that event? What did they actually do? Because that may be different than what they thought they should do. And then what were barriers to intervention, especially if the way they acted was different than what they thought they would do. So we're really looking at all of those kind of little nuances there to quantify their bystander behavior. But at this point, we're not at a place of looking at what about people who are in the bar? What are they noticing that's different? How does that change the way that they feel being in a bar environment? And I'm hoping that once there's a little more saturation of this in the communities, that we'll be able to do some sampling with folks that are just out in the community around the college campuses where there's lots of bars to see what does that environment feel like to them, even if they don't know that bars have been trained. We're also looking at, over time, ideally, what is the effect of this on community-level crime reports, which, of course, we know that the amount of crime that's reported to law enforcement is very small compared to what's actually happening. But we did actually just finish a study recently that will be published next month that's using GIS mapping to look at hotspots of police reports for violent crime in 4 major cities in Arizona, and we did find that there were hotspots of crime where you had high densities of alcohol-serving establishments. So if you saturate those same environments with this type of training, will we see changes in police reports over time? So that remains to be seen. So that's something we're doing. One last thing I want to mention on that is one of the reasons that we redesigned these posters recently and started putting them in different places was we've done a lot of sub-studies related to this, but 2 of them, one was related to bar staff and how they saw sexual aggression in bars and what they perceived their role to be in terms of safety. And we had done another separate a qualitative study talking to undergraduate women about their perceptions of sexual aggression in bars and help-seeking behaviors. And what we heard from the bar staff was, yeah, we absolutely feel like it's our role to help. We want to be there for patrons. If they want us, we are totally there. We want to help. And what we heard from the undergraduate women was, I often need help in a bar, but I'm most likely to either just leave or tell my friend about it than to tell a bar staff because I don't know that they actually want to help me. Not that I don't think they don't care. Actually, yeah, there were women that said, I think they're probably going to think that I deserved it, or I asked for it, or they're not going to care, or they're going to think it's not their job. So there was a disconnect, right? Bar staff said, yeah, we want to be here to help, and women were saying, I don't think they would help me, so I'm not going to go to them. So we had to fix that. We had to work on fixing that. So one of the things that we've done is we've brought that into our training as reinforcement for why bar staff need to be looking at all of these different strings of body language and contextual cues to tell them that something is going on, because patrons might not go up to them and let them know. But then we also wanted to reinforce to patrons this message of, hey, bar staff are trained in this. They are here to help you, to give them that little extra push to ask for it if they needed it. So it's a work in progress. Great questions. All right, I think that's my time. Thank you all so much.